Hi, everyone, and thanks so much for joining us. I'm Maggie Pocella, Senior Manager of Global Market Development in the Genetic Testing Solutions Business Unit here at Thermo Fisher Scientific. And today I'm joined by Dr. Manoj Gandhi, our Senior Medical Director. I'm going to be having a conversation with Dr. Gandhi today about what we might expect when COVID-19 meets flu season and RSV season. Thanks, Dr. Gandhi, for joining me.
Thanks for having me, Maggie. It's a pleasure to be here and having this discussion with you about a rather important topic.
Let's dive right in then. So with SARS-CoV-2 infections still spreading around the globe, it's pretty apparent that we're going to be at a point really soon where the flu season actually overlaps with the COVID-19 pandemic. Can you share a little bit about what we already know about co-infections of SARS-CoV-2 and other respiratory illnesses?
Yeah, first, let's talk about COVID-19. COVID-19 is quite a new virus, and we as humans do not have any immunity to this novel virus. As we have seen in the past 6 months, more and more of the population is getting infected with the virus. If one has to learn from other viral infections, there is a very good possibility that this virus could become endemic. In comparison, influenza has been around for about 100 years. If you look at the early years of the evolution of the influenza virus, the virus was also very lethal. While today influenza is still lethal, the mortality rate has dropped because we as humans have acquired a level of immunity to this virus. And now, influenza is a seasonal virus, and it is only in the winter months that the influenza cases peak in the northern hemisphere. The problem that we have here in this situation is that this season, the influenza season, will occur while the world is still dealing with the COVID-19 pandemic. As far as co-infections are concerned, the question that you asked, it is more likely that the patient either has one or the other rather than having both infections at once. There is limited data out there to say if co-infections can or cannot occur. There is a very real possibility that the patient who is infected with COVID-19 can be infected at the same time with influenza or vice versa. When one looks at the different studies being conducted, the most common infections that happen in patients with COVID-19 actually are patients having infections with RSV, which is respiratory syncytial virus, influenza A, influenza B, and other rhinoviruses. However, the most likely situation that would occur that the patient the patient who presents to the hospital has either one or the other, and the odds of being co-infected are rather small. Another possibility is that a patient gets infected with one virus and recovers, and then after some time falls sick with another virus. And in the worst case situation that a COVID patient does get co-infected with influenza or RSV, while we don't know what the exact course of the disease would look like, it is certainly expected to be worse than if it were one disease at a time. With RSV, this is something that is seen only in very young children and in older patients. And again, it is likely that the patient has either one or the other. Co-infections are possible, but the probability that it will occur is rather low.
That's all very interesting. Thanks so much. So with all of that in mind, what are your thoughts on how this knowledge and what you just shared and this twindemic is going to impact patient management?
So one of the issues that we as a medical community are concerned with the flu season overlapping with this pandemic is the issue of patient overload. Until last year, hospitals used to gear up for the flu season, and when things would quieten down after the season is over, things were back to normal. However, with the pandemic, the healthcare systems, especially the emergency departments and the intensive care units in some places that have been really hit hard by COVID, are already being stretched to the limit, and now they have to deal with the flu. While no one really knows what the true impact will be, this is one of the biggest concerns of the medical community, and that is patient overload. So that is one of the biggest concerns that we will see as a society when the COVID and the flu season and the RSV season will overlap.
Okay. So how does one clinically distinguish between the different respiratory infections we're talking about? So COVID and flu and RSV. And then what role does testing play into that?
The problem with these respiratory pathogens is that they all present with strikingly similar symptoms. And these symptoms are, typically fever, cough, body aches, and runny nose. There are some subtle differences such as loss of taste or smell and shortness of breath, and these are seen generally in COVID patients, but this is not seen in all patients. And for the most part, the symptoms between COVID and flu and even RSV are strikingly similar. So then the issue really becomes is how can a physician really distinguish one versus the other? Like I mentioned before, RSV is mainly seen as very young children and older adults. And again, interestingly, COVID is not really known to affect children as much. We don't understand the reason why. Maybe it is because of their immune repertoire is not as well developed as adults. Having said all this, it is really very difficult to distinguish based on signs and symptoms, and one really needs to perform a test to distinguish between them.
Okay, perfect. And so while we're on the topic of tests, let's talk a little bit about where test makers fit in. And of course, that also includes us here at Thermo Fisher Scientific. Can you share any updates about our own portfolio for the upcoming flu season?
Yes, it is really up to the companies like Thermo Fisher Scientific to make the tests that serve the needs of the physician, and more importantly, to serve the needs of the patients. We already have a test that has received emergency use authorization for the detection of COVID-19. However, with the flu season approaching, what we are doing here at Thermo Fisher Scientific is to make tests that can distinguish COVID versus flu versus RSV in a single test. So that with a single test, the physician is able to distinguish between these diseases and make the right decision for the patient. In this case of the COVID, flu, and the RSV test, it is a PCR test that is able to tell whether the patient has COVID versus the flu versus the RSV. The test does not tell you specifically whether it is flu A versus flu B, but it will certainly tell the patient, the physician, how to differentiate between these three types of pathogens.
Really exciting to hear. So while we're on that differentiating ability between these diseases with the tests, let's also bring in the therapies. So where do therapies fit in for flu, for RSV, and even now for COVID-19 as we've made some progress there?
One of the things that we have seen is that, whether it is COVID-19 or whether it is flu or RSV, the symptoms are fairly similar, like I mentioned before. And the mainstay of treatment for these diseases is mainly a symptomatic treatment. So one may ask, why does it really matter? If the symptoms are the same, if you have to distinguish one versus the other? And while it is true that the treatment is mainly symptomatic, there are some subtle differences and significant differences in the treatment of COVID patients versus flu versus RSV. What we have learned in the acute phase of COVID, that there is a phase where there is a cytokine storm. And this is where your immune system releases these chemicals that can actually have a very negative effect on your lungs. And this is what we've seen when it causes the shortness of breath that we see in these patients, and we refer to them as acute respiratory distress syndrome. This actually can be treated with steroids and interleukin-6 inhibitors such as tocilizumab, in addition to giving these patients respiratory support in the form of a ventilator. However, when you look at influenza, we generally do not see the cases where patients actually have the cytokine storm, and therefore these patients really don't present with the acute respiratory distress syndrome. So there is no need to suppress their immune system. In fact, in influenza, steroids are actually contraindicated because they actually are known to make the disease worse by suppressing their immune system and making these patients more susceptible to secondary bacterial infections. Similarly, there are very specific antiviral treatments that have been approved for the treatment of COVID-19 versus influenza. If you look at remdesivir, that has been approved for the treatment of COVID, whereas it has not been approved or not been tested in patients with influenza. Similarly, antivirals such as oseltamivir or zanamivir have been approved for the treatment of influenza, but have not been approved for treatment of COVID-19. When you look at RSV, it is important to differentiate COVID or flu versus RSV, because if you look at patients with RSV, while they present with the very similar symptoms, these patients really do not need any specific type of treatment, and symptomatic management is sufficient for this patient. Also, it is also very important to know if the patient really has COVID versus the flu or RSV, because the prognosis is quite different. Flu patients generally have a better prognosis. Similarly, RSV patients have a better prognosis than in patients who are exposed to COVID-19. And knowing this also is very important. Another important factor is the whole issue of quarantining these patients. It is very important to quarantine patients of COVID-19 to prevent the spread, or should we say slow the spread or stop the spread of COVID-19. With influenza or with RSV, one may not need to follow such strict quarantining procedures similar to COVID-19. Again, with RSV, generally you see them in very young children, and there is no need to quarantine these young children, and the risk of transmission to the person caring for the child is quite negligible. So for all these reasons, both from a patient perspective as well as from a public health perspective, it is important to distinguish COVID versus flu and RSV. And it is only through testing can one really distinguish if one has the COVID or has flu or has RSV.
Okay, that's wonderful. So there's also been a lot of news going around about a potential COVID-19 vaccine. And I know that that's still at least a few months out, but there is a flu vaccine already available to us. So what role is flu vaccination expected to play in combating the so-called twindemic that we're up against?
This is a great question. The flu vaccine is certainly that is available yearly, and this year more than any year, one should certainly get the flu vaccine if it is available. I know in some parts of the world, the flu vaccine is not really easily available and it's quite expensive. But in the United States here, flu vaccines are quite generally widely available, and one should certainly take it. As for whether the flu vaccinations will help combat against COVID, it may play a role in combating the twindemic by actually fighting against the flu. What we know about flu vaccines is they're effective against the flu, and even if one gets the flu after the vaccination, the symptoms are less severe than if one did not take the vaccine. Now, coming to your question as to the direct effect of the vaccination of flu vaccination on COVID, I don't think there is enough data to show one way or the other the effect that the flu vaccination will have on COVID-19. The two viruses are quite different. Influenza virus belongs to a different family called the Orthomyxoviridae family, whereas COVID-19 belongs to the coronavirus family. And these differences between the structure of the two viruses require that each of these viruses have its own specific vaccine. We hope that there will be a vaccine against COVID-19, and at some point, it will become a part of the flu vaccine in the future, so that with one vaccine, there can be protection both against COVID as well as the flu.
That's really interesting. I've also read some cool articles about acquired immunity, and I have to admit I don't know much about it. I was wondering if you could explain a little bit about what acquired immunity is in the context of COVID, flu, and RSV.
This is an interesting topic, and really much remains to be known. The way I see it is COVID is a very new virus, and we as humans have never been exposed to this virus before. So like I said before, there is no herd immunity against COVID-19. With flu, it has been around for 100 years, and we as a species have evolved with it and learned to live with it. With every passing year, our body gets used to a new strain of virus, either through natural infection or through immunization. Similarly, like we have with flu or with RSV, we have to learn to live with COVID too. COVID is just like other viruses will also mutate, and whether it is through natural infection or vaccination, when the vaccine becomes available, our body will mount an immune response. Our immune system would know how to deal with it, and as a result, as the virus evolves, it would not be as virulent as it was when we saw it our body saw it for the first time. This is the concept of acquired immunity. However, having said that, we are very early in the stage, very early in the process, and our journey with COVID has just begun.
Thanks for explaining that. That was very helpful. So we're kind of coming to the end here, and my last question is just, do you have anything additional that you'd like to share with us about the implications of the SARS-CoV-2 reemergence during flu season and any other complications that may arise during the overlap?
The one thing I would like to say is that, if we had to look at one, brighter, spot in COVID, through the whole thing, it's very hard to see the brighter spots in this whole pandemic, is that there is generally more awareness among people towards healthy habits. If people follow social distancing practices, wearing masks and PPE, and also the greater emphasis on vaccinations, such as the flu vaccinations, it may actually help decrease the incidence of flu this season, and it may be milder than previous years as a whole. In fact, there are some preliminary data that has come out of places from places like Japan and Taiwan, and in countries in the Southern Hemisphere that just went through the flu season, that actually it was milder than years before. So we hope that that is certainly a case, but only time will tell whether this will actually happen. So there's much to be learned as we come through this to this twindemic season, and we'll see how things work out.
Yeah, totally understand. And thanks so much. I really appreciate your time today, Dr. Gandhi. I learned a lot, and I hope that our viewers did as well.
My
That's it for
pleasure.
us right
Glad to
now.
be here.
Thank you.